snake.
Ow! Something bit me. I don't know what, but it was probably a snake.
Hey, fellow citizen, are you alright?
No! I got bitten by a sneaky snake.
Would you like me to help?
When dealing with anything like this, you want to use Doctor's ABC. D stands for danger. You want to look around for any danger, including the snake. In this scenario, the snake is not here. R stands for response. So what you're going to want to do in response is you're going to want to see if they respond to you. So, hello, are you okay? Do you need any help? There's no response. Now, I'm going to massage his shoulders and see if he gives any kind of response. There is no response, so I must move on to the next task. S stands for send. I need to send for help. So in this case, I'm going to call 000, and I'm going to say that we're in the bush and we have a snake bite victim. Now, what you're going to also want to do is if there's a bystander, if you give them a phone or you tell them to use their own phone, they can go and contact the ambulance, so then it could be quicker, and then you can continue with the Doctor's ABC. A in Doctor's ABC stands for airways. This is when you have to check the airway of the victim. Now, you're not going to want to tilt the head back, but you're going to want to have a pistol grip and you're going to want to put it on their chin. Then you're going to want to slowly open their mouth and check for anything blocking their airways, like vomit or blood, or teeth. If there's anything like this, you are going to want to put them in their recovery position, and you're going to want to scoop it out with your hand. People prefer using gloves or the victim's own hand. B in Doctor's ABC stands for breathing. Now, in breathing, what you're going to want to do is do the pistol grip on their mouth, open their mouth, put your ear against their mouth, and you're going to want to listen for breathing and look at their chest. Now, you're going to want to do this for at least 10 seconds and look at their chest. If they are breathing abnormally, you want to go straight to C, which is CPR, and make sure that a defibrillator is on its way. Now, CPR is when you have to hold your hands like this, and you have to find between here, where it's hard. And you're going to want to push down 30 compressions, and then two mouths. And then you have to do that for 24 seconds a cycle, for 5 cycles. So, I'm gonna demonstrate this. Do not do this at home, unless someone's, okay, so we're gonna do 30 compressions like this, just in the middle, here, with only this part of your hand touching chest. So we wanna go 30 of these, then you wanna do 2 breathing. So you wanna tilt the head back, do pistol grip on the mouth, we're gonna do 2. I'm not gonna do it, because this guy's gross. Now, in the worst case scenario, you want to use D, which is for the defibrillator. Now, if you want to use the defibrillator, first you need to probably remove their shirt. I can't take his shirt off. And then, once you have the defibrillator, you place one here on the heart, and you place one here on the stomach. Now, the defibrillator machine will work by itself. So, what you do is you do CPR, and then the defibrillator will monitor the heart rate and the breathing. Now, every now and then, it will ask, please stand back, shock needed, or, yeah. And so, you'll have to stand back, and it will automatically shock the patient. And then it will say clear, and then it'll say clear, and it'll say clear for CPR, and then you continue CPR until it keeps doing that until either an ambulance arrives or they get up, but you still wait for the ambulance.